So we were in the meeting with the consultant, and Jesse was very poorly at this point, not able to do anything because they were having to give him drugs to make him go to sleep. He was sleeping basically all day and all night. So the consultant was Dr. Leslie Judd, who's the consultant nephrologist at Great Ormond Street. She suggested that we thought about hypnotherapy, but wasn't able to give me the name of anyone. So we went on, started researching, and managed to find Sharon. One of the things after Sharon had worked her magic on Jesse was that the consultants were amazed at the difference. They basically said it was almost like a different child. And the registrar, who'd been struggling, had never actually managed to take blood from him ever before without him being very, very drugged and basically totally unconscious, was astounded and said he's like a different child. He couldn't believe that there was such a change in him, and was delighted as well because he'd been trying for so many weeks to actually get bloods out of him, and had been really patient, but all of a sudden it just changed, and it hasn't stopped. He's kept this ability to be able to do this, so it's been just fantastic. He started practicing self-hypnosis. He was able to numb the area where the pain was going to be, and actually make his blood come to that vein, so it actually started pulsing. He started even playing tricks on the nurses, because they were doing regular checks of his blood pressure and his pulse and heart rate and all the rest of it. So when they came to do that, and they were checking his pulse, he would make his heart go really fast and then go really slow, and even stop a heartbeat sometimes. And then they would just be, what's going on here? He just couldn't. And he'd get this little wicked laugh, and they'd go, what's happening? This isn't right. It was really fast and now it's going really slow. And he'd just laugh a lot. So it was amazing the confidence that he got from being able to do it all. So once he'd got the confidence and we were able to go in for had the regular blood test, he'd actually started getting better so much more quickly, because partly I think it was because he was able to accept the treatment more easily. We wouldn't have any delays with getting the medication that he needed, because the blood tests weren't a problem at all. But also I think he actually started being able to take control of his own body and allow the healing to start as well. So amazingly, his kidneys started functioning a lot better, and several months on from there now he's like a different child.